Carrie Evans, final video assessment, head to toe, part 2. Hi, I'm Carrie, your nurse, and your name and date of birth.
Jamie Winkle, September 10th, 1982.
Okay, Miss Winkle, is it okay if we finish with the assessment here?
Yes.
I'm just going to clean my hands, and I'm going to take a look at your posterior chest, okay?
Okay.
Inspection, your spinous processes are straight in line, and there's normal muscle development in your shoulders. No barrel chest noted. The ribs slope slightly downward at a 45-degree angle from the spine, which is normal. I noticed that she's not using any effort to breathe. No shortness of breath, right?
Right.
And so the next thing I'm going to do is I'm going to percuss or tap on your chest, okay?
Okay.
Okay, and all I heard there was normal resonance. There was no dull notes or no hyper or hypo resonance to percussion. And I'm going to turn you a little bit more, and I'm going to palpate at the costovertebral angle for any tenderness, okay? It's called CVA tenderness. Just tell me if anything's painful. No?
No.
Any pain?
No.
Okay, so normal CVA palpation there. And I'm going to listen now to your posterior chest. Breathe a little bit deeper than normal, just in and out. If you get dizzy, just stop, okay? Okay, and the lungs are clear. There's no wheezing or rhonchi noted. And so the next thing that we're going to do is I'm going to turn you around and I'm going to inspect your anterior chest, the front of your chest. Your skin is warm and dry. There's no skin lesions, no cyanosis or pallor. And I'm going to check for the vibrations as you say 99, okay?
Okay.
So
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
okay, and the tactile fremitus is normal bilateral. The vibrations are symmetrical in both the left and right chest, so that is normal. And I'm going to check for symmetrical chest expansion. Just take a big breath. Okay, normal symmetrical chest expansion with no lag noted, so that's normal. And I'm going to next just listen to your heart, okay? Okay. S1 and S2 noted. It's a regular rate and rhythm, a rate of 60. There's no murmurs, there's no premature or irregular beats, so that's normal. And I'm going to have you to lie down for me. I'm going to have you to just slightly turn to the left. I'm going to check for the apical impulse. Just straighten your legs for me. Just slightly to the left. One finger at the 5th intercostal. There's a 1 by 2 centimeter apical impulse noted. Just a slight tap, and that's normal. And so I'm going to just have you lie back on your back, and I'm going to listen to your chest now. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And that's good. I'm going to have you just to do the left lateral turn just slightly to your left again. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And I don't hear any murmur, so that is normal auscultation. And so I'm going to now inspect your abdomen. And I know that the abdomen is just slightly rounded, which just speaks of your good nutritional status. I'm going to inspect from the foot of the bed. I don't see any lumps or masses or unusual pulsations of your abdomen. And so I'm going to palpate now. I want you just to try to relax as much as possible. We're just going to do light palpation. Any tenderness or pain?
No.
Okay, I'm going to do a little bit deeper palpation. Again, just go to your happy place. Just relax as much as possible. No tenderness or pain?
No.
And I don't notice any masses or lumps. I'm now going to listen to your bowel sounds. And you have normal bowel sounds in all four quadrants. There's no hypo or hyper bowel sounds noted. And I'm going to percuss now. Just tap on your tummy, okay?
Okay.
Any pain?
No.
And there's just normal resonance there. There's no hyperresonance or dull notes noted there to the abdomen. And so now we're going to check out the lower extremities. They're symmetrical bilaterally. There's no edema. Your skin's warm and dry. I don't notice any lesions. It's normal color for your ethnicity. And so now we're going to check range of motion. Okay, if you can raise your right leg as far as possible. And that's a good normal range of motion. You can lower and do the left. Raise the left. There you go. Okay, raise against my hand and back down. And again over here and back down. So good muscle strength. I'm going to help you with your knee, but I do want you to bend your knee up. Okay, and now I'm going to check for internal and external rotation. And that's normal. Okay, bend your knee up against my resistance. Okay, that's good. And so do the same over here. Bend your knee up. Good internal and external rotation. This is external, this is internal. And I want you to bend your knee up against my hand. Okay, good muscle strength. I'm going to check your ankle range of motion now. Point your feet down and plantar flexion. Okay, your toes back toward your face. Okay, that's good. Dorsiflexion. And so turn your soles of your feet together. Good inversion. Turn them out. Good aversion of the ankles. And so I'm going to test your strength. I want you to push down like you're pushing on the gas. Okay. And then pull your feet up at your ankle. Good muscle strength in your ankles. Spread your toes. I'm going to try to pull them together. Okay. Very good. Okay, I'm going to have you to sit up on this side of the bed. And while we're here, I think I'm going to go ahead and do your patellar reflexes. Your feet are just dangling at the bed. And I'm going to tap here and tap here. Okay, normal patellar reflexes. I'm going to have you to have a seat back over here. And we're going to check the range of motion of your upper extremities, your shoulders, elbows, wrists, and hands, okay? And so put your arms down to your side and raise your arms up above your head. No, from this side.
Okay.
There you go. And then back down. And then do that against my hands. Okay, and then back down. Okay, so good muscle strength there of the shoulders. Okay, put your arms out in front of you now and raise them up above your head. Okay, and back down. And do that against me. Okay, and back down. Good muscle strength. Put your hands behind your head. Okay, good external rotation of the shoulders. Put your hands behind your back. Okay, good internal rotation of the shoulders. And now I'm going to check the elbows. Just put your hands out in front of you and bend your elbows up towards your shoulders and then back down. Do that against me. Just your elbows. Just bend your elbows. There you go. And then back down. Okay. And then let's check your wrist. I want you to point your fingers down and up. Okay, spread your fingers. And I want you to try to keep them open against me. Trying to close them. Okay, good muscle strength in your upper extremities and good range of motion of your upper extremities. And so the next thing I'm going to do is check your femoral pulse, your popliteal, and I need to do that with you lying back down. I'm sorry. I'm going to check, just relax, okay? Femoral pulses are normal bilaterally. Popliteal, palpable bilaterally. Posterior tibial pulses are positive bilaterally. dorsalis pedis pulses, or positive bilaterally. Okay, and I'm going to have you to stand for me. And I want you to stand right here. And let's just have you to bend over at the waist, okay? And your shoulders are even and symmetrical. There's no, your hips are also symmetrical. You can stand back up. So no scoliosis, lordosis, or kyphosis there. And I'm going to just have you to lie back on the bed. Sorry. This is just a neurological test. I want you to close your eyes, put your left heel on your, your left heel on your right knee, and then just slide that heel down to your ankle, and do the same with your right leg. That's heel to shin, and so that's a normal neurological reflex test, and so that's good. Okay, so this is Carrie Evans, and it's my final video assessment head to toe. And my patient is Jamie Winkle. She's a 33-year-old female. She's pleasant, well-groomed, did not use any assistive devices, has no obvious physical defects. Her gait was normal. She was clean and well-groomed, alert and oriented, ×3. And her skin was warm and dry and pink, had good turgor. There were no skin abnormalities. Her cap refill was normal. The temperature of her skin was normal. Her scalp was normal. Her hair was normal. Her skull was normocephalic. It was round with no depressions or lumps on it. Her facial nerve, cranial nerve 7, was intact. Her cranial nerve 8, the vagal nerve, was intact. Her uvula raised when she said ah. She had a positive gag reflex, so cranial nerve 9 and 10. Glossopharyngeal and vagal were both normal. She was able to stick out her tongue, so cranial nerve 12 was normal, the hypoglossal. Her ears and her hearing were normal. There was no tenderness. Her external ears were normal. She was able to hear with a whisper test. So cranial nerve 8, which is her auditory nerve, was intact. Cranial nerve 1, her olfactory, was intact. She was able to smell a strawberry flavored hand sanitizer, so that was normal. Her mouth and oral mucosa, buccal mucosa, was moist and pink. There were no dental caries. She had normal occlusion of the teeth. Her tonsils, excuse me, were visible at 1+. I'm sorry. Her cardinal fields of gaze were normal. Cranial nerves 3, 4, and 6 were intact. Oculomotor, trochlear, and abducens. I'm so sorry. Cranial nerve 5, trigeminal, was intact. Her thorax and lungs were normal. Clear, minimal respiratory effort, no distress. Her abdomen was normal to inspection and auscultation. Her lower and upper extremities both had normal range of motion and good muscle strength. Patellar reflex was normal. The femoral, popliteal, posterior tibial, and her dorsalis pedis pulses were all normal, thank you, and palpable bilaterally. Her scoliosis screen was negative. And her thyroid, I'm going to check if we didn't do that. I think that was on the first one. Never mind, I'm so sorry. Her thyroid was normal when palpated from the posterior side of her body when she swallowed. And this is Carrie Evans' final video assessment head to toe. And I'm sorry, apparently I need an assessment because I think I'm getting sick. Thank you very much. I've enjoyed your class.